headquarters. An ABC4 News Town Hall special, Coronavirus, a Path Forward.
All right, we're back live from Utah's Capitol Hill having a conversation with candidates for governor. We are joined by Lieutenant Governor and candidate for governor Spencer Cox. Great to have you with us. Thanks for sticking around. We're going to now move into some of the more controversial elements of the response. I understand that you were in a darned if you do, darned if you don't situation. I understand there are various agendas at play here, but I think there are some fair questions to ask here.
Sure.
Let's start with the hydroxychloroquine. The state did move forward with a purchase of $800,000. There was up to $8 million set aside to potentially purchase. Why did we get to the point where we were already making purchases of drugs that were not tested and proven?
Yeah, so if you go back early on in this decision, you'll remember that there was some studies, initial studies out of France that said that hydroxychloroquine may be effective in fighting this virus. And then President Trump was touting it and saying that it was very effective. Our committee, our task force was not involved in that decision. But there were many legislators and others who thought that this was a really good idea. If it proved out that it worked, we could save, look, our economy is losing between $20 and $30 million per day in GDP, and their push was to find a way, if there was any way, to stop that and get the economy back open to do that. And so there was this big push to purchase hydroxychloroquine. There was the initial $800,000 purchase that was made. I wasn't aware of that purchase. We found out afterwards. We pushed back on that. We were able to get taxpayers' money back, got the full $800,000 back. And look, as we talked to people who were involved in that decision, everyone was trying to do the very best they could under very difficult circumstances. And so we understand that, and we're glad we were able to get the money back.
Looking back, should you have been aware of that and been more involved in that situation?
Well, possibly. I mean, look, there are mistakes made anytime you're in a situation like this. Remember, there is no roadmap for dealing with a pandemic, and certainly hindsight makes things a lot easier. But in the moment, our teams were working 18 to 20-hour days. We were making millions of decisions and recommendations. Again, everyone, the entire team, and so some of those definitely slipped through the cracks. That was one of those, and in retrospect, we wish we could have stopped before it happened. But it did happen, and the good news is, we were able to get the taxpayer money back, and so we're good to move on.
What about the Test Utah testing that we've had? We've had sources come out from the health department, from Intermountain Medical Center, saying we're a little concerned about the results we're seeing coming back at a positive rate about half of what we're seeing elsewhere. Are you concerned that we are getting some questionable results there?
So when it comes to testing, one of the things we learned very early on in this process, and one of the decisions we made, was that testing and tracing were the only ways out of this pandemic. And we didn't have testing. That's how we got into this problem of having to have people stay at home in the first place. The United States was way behind on testing. We're just now catching up. The good news for the state of Utah is that we have many groups who were involved in testing. So we have ARUP, one of the premier labs in the country. We have IHC, who has done amazing work, and then Test Utah from the private sector, working with a hospital and a real lab down, HCA lab down at Timpanogos, stepped up and said, hey, we can do this and we can process these. Now, anytime there's a disparity in testing, that's a concern. So we have asked to validate those tests to make sure that they have a positivity rate or a negativity rate that fits, that the tests are valid. They are using a valid FDA test. Now, I'm not a lab technician, but we are trusting our lab technicians who are working closely with them to validate those tests and make sure that everything is legitimate. And so far what we've heard is that there are positive reports coming out.
I think another thing that caught people's attention with this Test Utah thing is that it was sold, at least this is how I took it and a lot of other people did, it was sold as the tech community coming together, crowdsourcing, kind of a charitable type event, but then we've seen multi-million-dollar contracts awarded. Your thoughts on that?
Yeah, so look, when it came to testing and how important it was to ramp up testing so that we could move to reopen the economy, their original idea was one testing site. And so our team went back and said, we need more testing. We need to get to 7,000 to 10,000 tests per day across the state. And ARUP could only do so many, IHC could only do so many, the state lab could only do so many. And we had this gap that we had to fill. And so they said, yeah, we can do that, but we need to pay for that somehow. account. We had CARES Act funding that said that we could use it to increase testing in the state of Utah. So it was actually the state who said, we're not going to ask you to do this for free. We actually need to ramp up, and it's going to cost money to do that. We're happy to pay that. Look, I would much rather pay entrepreneurs from the state of Utah to do the things that we need done, like testing, than what we're doing now, which is paying extra for supplies coming out of China. And I would rather the money stay here.
Do you stand by the decisions that were made as far as medical professionals were given the proper input to make the right decisions, or were they being more driven by business?
Oh, no, so that's what's so important about the state of Utah is that we have had medical professionals at the table in every discussion. We're going to let data drive the decision making here in our state, and we're very proud of that. So yes, the economic decisions are important, by the way, and they're equally important. There is a real crisis happening, and when you lose your job, when you lose your business, there are health impacts to that as well. There are mental health impacts. I know something that
that's a really
we'll
good
talk
segue,
about,
because we're going to get into that next.
Yeah, but there are domestic abuse issues that we're seeing out there. Again, having a job is critically important, and so we can't throw that away. There's this false dichotomy that we have to choose between people's health or we have to choose between people's jobs, and that's just not true. By keeping people healthy and safe, we're going to get our economy open sooner, and by focusing on getting the economy open, we're going to save people's lives.
All right, coming up, as we just mentioned, historic levels of unemployment, widespread isolation, they are taxing our mental well-being. How Spencer Cox says he would address a brewing mental health crisis after the break.